So my name is Ari Tuckman. I'm the co-chair on the Chad side here, and we have a number of other good folks on the call, which we'll work our way through. But we're going to start out here with doing some Q&A. So our keynote speaker, obviously, is Dr. John Ratey, who is, kind of a household name in the world of ADHD. If you don't know his name, then I don't think you have ADHD. So we started putting together this conference where we want to really focus on the sort of health impacts of life with ADHD. Bam, first name for a keynoter, John Ratey, talking about exercise, benefits of the brain, how it is helpful for ADHD, anxiety, depression. So that was a total easy call to say that this is the guy we need to open things up. So as people begin, continue to sort of file in here, John, let me ask, just some kind of starting comments. What would you like to say? What sort of questions are you looking for, or what else has sort of come to mind since you recorded the presentation?
Well, I guess just suggesting that people make a plan to exercise. In other words, you get into some kind of, whether it's the beginning of the day, especially when you're COVID bound, and sequestered, to have either a morning or afternoon or an evening ritual where this is where the internet is so great, because there's so much on there. You can do Zumba. My wife and I did Zumba for the first month when we were here, and I'm not a dancer at all, but I got into it, and but also I have a kettlebell routine that I do with Chi-Chi every morning. Me and Chi-Chi are doing 15 minutes of kettlebell routine, and then we do our walking and all that, but you got to plan it. That's the first thing. I think it's so imperative, because if you don't plan it, you won't get into a rhythm or a system. And that's the only way to start and stay with it. And then you have to acknowledge to yourself what you feel after you're done, and how much different the day has gone after you've exercised. If you put in 30 to 50 minutes, you'll be a different person that day, and your ADD will be in much better shape as well, whether you're taking medicine or not. It's so imperative. And I think I mentioned at the end of my talk there, the 7-minute exercise. It's an app for your phone, which is really a good 7 minutes of calisthenics, but with a leader that'll take you through it. And it really gets all your major muscle groups going, and raises your heart rate, which means your brain is working more, and gets you into a different space.
Well, and related to that, it's kind of more of a comment in the chat, but I'm gonna say something about it. So, person says they have ADHD, no meds. I get up and put on my exercise clothes, then I know I will work out. I put exercise on my calendar as a category. Yes, exactly. This is exactly what you're saying. If you make it an intention, if you get your clothes on, you're like halfway there.
It used to be, we'd say that when we used to go to the gym, if you made it to the car, you were going to go. Getting your clothes on is a good start, or bringing your clothes with you, but getting into the car to go to the gym used to be the kind of thing that you're going to make it there.
Right.
Because with ADD, 26 million things come up that prevent you from leaving the house. A phone call, this, that, the cat, the dog, the kids, whatever it is. Something will interfere.
Yeah. So, And I think that's kind of an important part of it, is to recognize that there will be obstacles. Let's think about what they might be, and then let's have a plan for what to do. Um, so for those participants who've raised their hand, I think it's going to be hard for me to get to those. So my advice is just put the comments or the questions in the chat. So let me ask a question here. So what would you suggest to help a young adult who has ADHD and also social anxiety? He's bright, he knows that he needs exercise, but he just can't motivate himself to do it. So there's a few nuances that we're touching on here.
Well, that's where, again, I'm thinking of COVID times. That's where the YouTube is amazing to do, whether it's yoga, whether it's Chi kettlebell, whether it's Zumba, something that you don't have to be around people. You have the box in front of you, and we're all living on the box these days, so that can get you started and get you into it. So it's not like you go to the gym anymore and you're a member of, or even CrossFit. CrossFit is all Zoom related, right? And it used to be the perfect way of dealing with your social anxiety too, but is to have a workout group. But we don't have that. I mean, I can't recommend that now. Maybe a walking club or a running club, but stay far enough away from each other, because COVID is everywhere. And, we really have to pay attention to that, and especially ADD people, because you're more vulnerable, because you forget to, even though you've been 6 months being really secure and not breaking the rules and not, getting too close to a group, but, you have ADD, and if there's a group, bingo, you might be drawn in, and, because it's interesting. And you're missing it. So, we further have to stop ourselves. We say, oh, no, just this one time. Yeah, well, that's what you got to
so it begins.
Yes.
Yeah. So let me actually ask this question. It was a statement, but I'm going to turn it into a question. The statement was, I need to be held accountable. So, yeah, definitely. I think we'll probably all do better with a little external accountability. It's not our own internal sense that's holding us accountable. What do you recommend in terms of maybe habit change in general, but specifically exercise?
Well, no, exercise in particular, I would say. I mean, it used to be again, in the old days, pre-COVID, say, join the gym and hire a personal trainer, because you have to pay for it anyway. And people are much more liable to go if they're paying for it. Okay, that's just something. And so there are websites that are YouTubes or blogs or websites or whatever that you can join, that you pay for. That you spend 20 minutes 3 times a week. Like my wife still does a Zumba twice a week, and she pays for it. And that gets you into the game. That will make you more liable to do it, because if you're paying for it, it's a commitment on the other end. And this is why group exercises are so good. But again, you have to deal with COVID. And so a walking group, there's a lot of walking groups that spring up around, but you have to, maintain safety. So, and that's where another person really draws you in. That's where the accountability comes from. The other person, whether it's a personal trainer, a coach, or, you're a member of a spinning group, which we don't have anymore. And maybe that's where Peloton and all these new things are. I've not done it, so don't know, but I imagine that you're part of a group there, and that brings you, that's the cohesion that you need to get you going and get you with it. And then there's a little competitive stuff that can happen, there's always self-competitive, but then competitive with your neighbor or you're with a member of the group.
Yeah, one of the things that I sort of notice with when I have clients who really are struggling to make a change like this, is that we need to start looking beyond just the thing that's not happening, right? So in this case, exercise, it's also about, if the rest of your life is too unmanageable, then exercise becomes one of the first things to go. So, which kind of brings us to a question that I got, which is, and I totally appreciate this dilemma. The question is, lots of kids and adults with ADHD don't get enough exercise or sleep. In case of doubt, what should be emphasized? Get up early to exercise or not? And I can definitely relate to this one. So what are your thoughts?
Very good question. However, I would say get up, set your alarm, get up, because that then will help you regulate the sleep. So you have to pay attention to what's called sleep hygiene. You have to make sure you're going to bed at a good time and with enough time to sleep. And exercise will put you into a better sleep stage. You'll get more deep sleep or stage 4 sleep. You'll have a little more REM perhaps when you exercise. And so your sleep is more restful, more health promoting, because the more time you spend in stage 4 sleep, the better it is for your body and your brain.
Right. Yeah, and they're definitely connected, exercise and sleep. Although I gotta say, what I find is if I had a bad night of sleep, despite trying my best, I swear the best thing I can do is a hard workout. It kind of blows the, cobwebs out, knocks back the headache, definitely make it through the rest of the day a whole lot better.
Yeah, no, it changes all the chemistry, which, I talked about in my lecture. The chemistry is remarkably changed with even 20 minutes of exercise, even 10 minutes of exercise, even jumping rope for 5 minutes, because you'll get intense. I think I heard from somebody who mentioned in the chats, people were talking about getting a jump rope. Yes, do it. It's cheap, and all you have to do is get outside, of your house if you can, or even inside. But it's great. It does everything. It challenges your cerebellum that I mentioned, that we mentioned in our new book, and it also raises your heart rate. You can do the balance and coordination and challenge, and then you get sort of bored and you do it faster, and then you do one foot, another foot, whatever. It just all you get there. You get there because it's practice.
So let me ask kind of a related question. What's your advice on the timing of exercise and sleep for someone who has sleep issues? So is it better to exercise earlier? Is it better to exercise later? What's your thought? This is definitely a question I get. So
Yeah. No, it's a good question. Well, and that's been looked at. All kinds of things have been looked at with vis-a-vis exercise. And so they looked at people who exercise early and exercise, after dinner, in the later part of the evening. And they find no difference in the effect on getting to sleep. But it has to be about 2 hours before you go to bed. That's what I recommend. Now, some people can exercise right up against going to sleep, but most people not. You get everything wound up, your body and your heart rate, and and your brain's on fire after you exercise. And so you really want, it depends on what you're going to do too. I mean, if you do yoga and calm down, you do deep breathing, you know, maybe that's a good way to glide into sleep for people.
Yeah. So in other words, you do what works for you.
Well, yeah, no, but
Yeah.
it's important. I mean, what I say, the timing, the best timing, especially for ADD people, is in the morning, because you clear out those cobwebs, you turn, it's like taking another dose of medicine. Like, for instance, when people that I have, I say, look, don't take your medicine until you exercise in the morning, because you're wasting it. You're wasting the medicine, because you're going to do the same thing that your medicine does with exercise. Now, it's true, if you take your medicine, you might be able to do more exercise. You might be able to, you know, be more proficient and push yourself more and remember what the heck you're supposed to do exercising wise. But on balance, you want to exercise first, wait for about an hour and a half, and then take your medicine. That way, your medicine will be working for you, and more importantly, in the better part of the day.
Let me ask maybe a little bit of a related question. So, and again, this is a statement, but I'm going to make it into a question. So the statement is, the only time I could meditate was on Centuries. I'm not sure exactly what that is. Or in the spin studio, eyes closed, a very sweaty meditation. So, you know, there's all this talk about mindfulness, right? Mindfulness is going to cure everything, and it's going to make you 3 inches taller as well, right? So, and yet, for a lot of the folks who are attending our conference, you know, like, it's the Geneva Convention worthy form of torture to make them sit and do nothing for 20 minutes, right? So what are your thoughts here on, you know, how do we sort of combine exercise and mindfulness and sort of put it together for the best of both worlds?
The best I have found with my patients and myself, the best time to meditate is almost immediately after you've done exercising. You know, if you really pull up a sweat, you get, like, for instance, yoga. You know, yoga, you go through all these different postures, different exercises, you stretch, you strain, you hold. And then at the end, you get the time, 10 minutes of meditation, and you really relax. And you can, it's the only time I could have my patients mainly, and myself, that's when I could really meditate, you know, because, you know, your muscles are much more relaxed, your tension is down a bit, and you're a little bit tired, and or a lot tired, and you just couldn't, you know, focus on breath counting or what have you, you know. And also for bod meditation, you know, the guided meditation apps are really cool. You know, I mean, they're really good. Headspace or mindfulness, which is another one. You know, 5 minutes, 10 minutes, and nice voice sort of leading you on to it. And it keeps you with it. And the trouble is staying with it, like anything. It's just staying with it, because you get busy, and that's easy to scratch off the list.
So what are your thoughts on this? There's been kind of a number of comments here about kind of boredom, right? You know, getting tired of doing the same thing. And I think there are some people where just sort of having the routine and just kind of being able to autopilot just really makes it easy, right? They just kind of grind out their workout and they don't have to think that hard. And then there are others where if they keep doing the same thing, they're just not going to do it. So what are your thoughts on kind of keeping it interesting?
Well, that's where you have to either vary the routine or vary the intensity. So exercise, by some people's definition, is always moving it above your comfort zone. You know, always challenging yourself a little bit more, whether it's time spent or the intensity of your exercise. You know, whether you're walking, you start walking up a hill, or, you know, running, Or you do I mentioned HIIT, which is a terrific group of exercises. And believe me, the internet is full of free YouTubes with high intensity exercise, with or without weights. You don't need weights, because you can, like the 7-minute exercise is fairly high intensity, and it's only in 7 minutes. But the really HIIT is get you moving for 30 seconds at your peak, and then resting for 10 seconds, and then repeat, 8 times, and then you've done a Tabata. And Tabata is a great high intensity interval training, and it really works. You get it done out of the way. You've really increased your cardiac capacity. You've lowered your blood pressure. You've lowered your heart rate. Just it's just all around a good thing. You lose weight too if you do it.
And it sort of fires up that competitiveness. So even if it's just you banging away, right, it gives you something to be competitive with. It makes it quick. It makes it exciting. So
yes, yeah, and you talk about varying. So here's something. So I have a friend who said, okay, let's do squats. Let's do 200 squats a day. Okay, and then we got to 200. And then he went on to do 300. I never did that. It was just too much. But 200 squats is a lot, and you get into it and you build up gradually. It's just like the push-up. Remember, there was a big thing on the Facebook about 22 push-ups a day. You get to that level for the veterans and anyway, I don't know what exactly the deal was, and people were posting their videos of them doing their 22 push-ups, and getting there. And so you add in things, you keep adding on and challenging yourself. And it makes it more fun. You feel more relieved. You feel like you're done. And you've gotten you've changed your brain and your body in a very good way.
well, whatever it takes, any exercise routine is better than one you didn't do. So
Yes.
certainly find the ways to make it interesting, find the ways to keep you coming back. Definitely a social component helps, if you can swing it. And even just, like you said, posting up videos like that makes it social. So
Yeah, but somebody I saw a chat about planks. Does planks count? Absolutely. Planks are great. First you start off with 10 seconds or 20 seconds or whatever you can do, and then you build up and you keep challenging yourself to get up to 2 minutes of a plank, and that's allowed. And then you go on, and we used to, when we did groups in the old days, in pre-COVID days, you'd challenge each other to see who could remain in a plank position the longest. And so that added that competitiveness into it. When I was in China, this one guy said, I can only do my plank for an hour and 10 minutes, and I said, what? And he said, is that good? I said, that's good. That's amazing.
Well, everyone's got to find what works for them. So, but my hope is that, this kind of opening keynote here has inspired everyone to action, especially as we head into the cold and the dark of winter. All the more important to keep moving, keep your mood up, find something interesting, find something that's going to keep you coming back. There's been a bunch of good recommendations in the chat. I recommend everyone check those out as well. But on behalf of the whole team here and all the people behind the scenes, definitely, Dr. John Ratey, want to thank you for starting us off. on just the right foot here. So as always, we appreciate your involvement with CHAD, ADA, and ACO. So thank you, thank you, thank you.
Okay, good luck to you all.
All right, thanks.
Bye-bye.
So we are going to do some quick announcements here, and just to sort of finish off the evening and set us up for tomorrow. So normally this is kind of the stuff that happens before the keynote when we're like live in person. So this is gonna be a little bit weird that it's coming afterwards, but welcome everybody. I'm Dr. Ari Tuckman. I'm a psychologist and author. I'm the CHAD co-chair of the conference here. So let me start off by, let's do some quick hellos from the three sponsoring organizations, starting with Dwayne Gordon from ADA.
Hello, everyone. Welcome. I'm so glad you could join us. We're not getting the same hugs that we were, but we've been getting some great advice, some great chats. I've met with lots of people already. This keynote was fantastic, and the next 2 days are just going to be more of the same, like a lot more. So figure out your technical glitches, clear your schedule, and dive in, get into everything that you can. ADA welcomes you, and of course, we're not alone. So I'm just going to hand it over to Tamara Rosier, who's the president of ACO. Tamara, it's off to you.
Hi. Yeah, thanks. Hey, I wish I could see all of your faces and greet you guys personally. I'm imagining all your faces, so you're all smiling at me, giving me thumbs up right now. So ACO is so happy to be working with CHAD and ADA to put on this conference. This is a great place to be. So ACO represents ADHD coaches. If you're interested in finding a coach, stop by our booth. If you're wanting to become a coach, stop by our booth. Somehow just stop by our booth anyway. And now I'll pass it on to Pat, the president of CHAD.
Hi, everyone. Welcome. I'm so very excited that we were able to bring you this year's conference. Even though it's virtually, we are here, and I'm just so very excited to see so many familiar faces, or at least imagine so many familiar faces sending out virtual hugs. CHAD is very excited to be co-hosting again with Dwayne of ADA, Tamara of ACO. The partnership with our three organizations truly brings you the best of the best. So welcome, enjoy, and have a good time.
Hi, I'm Chris Scrott, and I am a professional organizer. So I added different dynamics to the committee. It's been a pleasure to be here. This is my second year, and I do think we should give a hands up to like everybody in this committee. Everybody worked really hard behind the scenes, and there was such an amazing job. And we had such an amazing turnout for a conference, which we're super excited about. So even though this was a different conference and we couldn't hug each other, I think it's really cool how we've been able to connect this way. And a couple of things that I want to remind you is that all of the sessions are pre-recorded, so they're available. Like today, I was able to listen to one after it started, so you can start them at your own time, and they will be available for the next 2 weeks. So you can go back and listen to anything that you would like. There's so many sessions. I always hate when they're competing ones in between. So this time you don't have to compete. You can just stay up all night listening to everybody. You can invite the speakers and any of the attendees for meetings. So that's a really cool feature. If you wanted to meet someone, there's a tab that you can just click on, and then that person gets a notification, and then you can connect with them, which is a great way to meet new people without having to stalk them around the bathrooms like we had to do before. And I think that's it. I hope everybody's having a good time. I saw so much engagement in all of the sessions that I attended today. So I think that is a great way to just stay connected, is to participate and contribute whatever you're learning. So it's nice seeing all of you guys. Oh, I think Melissa.
Okay, it's great to see you.
I forgot my hand off.
You'll hand it off too. It's going great. So I know we feel pretty connected here, even on the Zoom. And if you'd like to capitalize on that, we are finishing off today. We're capping off the day with a lot of peer groups are meeting. We have 10 different peer groups: young adults, women, African American, plus ADHD, a high IQ group. Please have a look, see if that's something you'd like to do, get even more connected. So I'm saying end the day right, and then I'm going to say start the day right, because tomorrow I think there is daily morning meditation on the calendar. Also grab your lunch and take some time to lunch and learn. I think Saturday we're going to have Rick Green sharing about his odyssey of the ADD and Loving It movie, 10 years on. And this Friday night, The Talent Show, hosted by both Dean and Sari Solden. We're in for a special treat. Revel in the creative energy of other conference attendees and presenters. Yes, I might be among the performers, and no tickets needed this time. Saturday, we've got the Women's Unity Lunch. That we brought them with us to the virtual world. This year it's hosted by Sari Solden, Terry Matlin, and Liz Lewis. And on Saturday night, for those of you looking for one more thing, we're going to have improv for learning social skills with Mike Fidel. And a special treat, Brendan Mahan is doing a live Dungeons and Dragons game. You can see his lunch and learn earlier in the day on Saturday, where he explains what are we learning by playing Dungeons and Dragons, and then you can forget what you're learning and just have a good time on Saturday night with Brendan. So back to you, Ari.
Nice. So this is a different kind of conference, but hopefully it's a good conference in some different ways, along with a lot of the stuff that makes the regular in-person conference great. And if all goes well in the world, we will be back together again, probably in Baltimore, most likely in Baltimore, but let's see how the world evolves. And if you are having any tech issues, you can go to the Site Assistance tab at the top of the menus, at the top of the pages. Also, if you email chadsupport@gtrnow.com, they have a team of folks who can quickly respond and help you get sorted out. So otherwise, you will be getting links to do evaluations of the sessions that you attended. And in terms of CE credits, again, you'll be getting emails with if you're looking for CE credits for the little quizzes you need to do. They're not going to be that hard. And you submit those, and then you submit the paperwork, and then you'll get your credits. So that will all come right at the end of the conference. And we will see you guys tomorrow morning in the East Coast, tomorrow painfully early on the West Coast, and tomorrow midday in Europe for Kathleen Nadeau's Friday keynote. And then we'll finish up strong on Saturday. So thank you, everybody, and have a good rest of the night.
Bye, everyone.
Good night, everybody.
Good night, all.
All right, I'm replying to the chat here.
Well, except for the people that are still going to all of the amazing sessions that Melissa put in the after hours.
I know. Look at all that good stuff.
There is so much good stuff on the menu. The program, that's the word.
Good job, Melissa. Thank you.
There's always people who want to have fun. We just got to make a little spot for them to do it, right?
Yeah.
Okay. All right. See everybody. See you tomorrow.
Alrighty. Bye, Ari.
Okay.
Bye,
Good
Melissa.
night. Thank
Bye.
you.